Rebecca has a ritual which she shares with millions of people on the planet. She has diabetes, so she needs to closely monitor her blood glucose levels because her pancreas doesn't produce enough insulin. The less insulin you have, the higher your blood glucose level. For those with type 1 diabetes, it can be a potentially life-threatening condition. In Rebecca's case, she's 6 months pregnant, and this means that she needs to monitor herself every 2 hours. Patients with diabetes are up to 4 times more likely to have a stroke, heart attack or go blind than people without diabetes. So blood glucose monitoring is literally their life. Well, in the next few years, there may be a much less invasive way, not to mention less painful way, to check your blood glucose levels. It's an inspired piece of lateral thinking and cross-technology. Trinity College Cambridge and partner Smart Holograms have found a neat solution to a complex problem. They're putting holograms on contact lenses. Beyond tomorrow, they reckon blood tests will be gone and you'll be able to monitor your blood glucose levels using these clever holograms.
If you take a credit card, you'll see there's a hologram on there. That's what I regard as a dim hologram, because all it does is reflect light back. What we have is what we call smart holograms.
Professor Chris Lowe's so-called dim holograms are common on banknotes and credit cards. It's basically a 3D reflection. But smart holograms are engineered to only reflect light when triggered. They're printed on reactive polymer sheets. The sheet is chemically sensitised. When it comes into contact with glucose-rich fluid, it turns blue. The holograms in lenses will reflect different colours according to your blood glucose level. So I guess the big question is, why choose a contact lens? Well, many people with diabetes already wear them, and even if they don't, these diagnostic lenses can easily be made blank, so there's no vision correction whatsoever.
The little brown dot's the hologram, and it's actually inside a normal contact lens. And what that does is it comes into contact with your tears. Your tears are linked to your blood, and the amount of glucose you have in your blood is reflected in your tears. Now it's brown because we just want the hologram easy to find. But normally what would happen when we put this in a contact lens, it would be colourless. So you wouldn't see it and it wouldn't affect your vision.
A special torch-like instrument has been devised to reflect light safely into the eye. Depending on your blood glucose level, the hologram will turn this light certain colours, which are read by the instrument. Within seconds, you have a glucose level readout. Diabetes is just the start. It won't be too long before these smart contacts may be able to monitor other conditions like high cholesterol or high blood pressure. It's the kind of core technology that could radically improve the way we all monitor our health beyond tomorrow.